I'm glad I wasn't recording yet, since that was pictures from a real call that happened in California. So what I have over here now is it's a Excel spreadsheet. I'm trying to find it a different way. But what I want us to do, because I'm hoping you guys read ahead, is let's talk about this stuff. So let's start out with an easy one. Now, what this table does is we're going to talk about signs and symptoms that are unique to asthma, unique to emphysema, chronic bronchitis, pneumonia, and CHF. Unique to them. And then we're also going to talk about common signs and symptoms. So first off, let's find out what's happening in asthma. I'm an asthmatic.
Your bronchioles are constricted.
Okay, and why are they constricted?
Due to inflammation.
Okay, inflammation that's causing mucus to build up. And so our bronchioles are constricted, not a lot of air is going in, and we already know what happens. So what are some of the unique signs and symptoms of asthma?
Wheezing.
Wheezing.
Okay. Is there anything in particular about the wheezing?
Wouldn't it sound like a
It
whistle?
eventually goes away.
That doesn't get bigger. Can you guys see that expiratory wheezing?
No, sir.
Better? Better? Okay. All right, so we have expiratory wheezing. What else?
Your chest is tight.
What do you mean?
Like you're not able to breathe.
Okay, but how?
You can't get it in.
Okay, but didn't we just talk about that, the wheezing? Because of the constricted bronchioles? So why is there chest tightness? What do you mean chest tightness? I'm not saying I disagree. I just want to know how.
Is it because you're using your muscles or your accessory muscles?
Okay. In a way, though, isn't that common with the other conditions? Is that one S or two? Two. So chest tightness, in as much as it's hard to get air through the constricted bronchioles?
Yep.
Yes, sir.
Okay. So what else?
Shortness of breath.
Okay, but isn't that common with all of them?
Hmm.
I didn't hear anybody say yes or no.
I'll say yes, sir.
Okay.
Lou,
Yeah.
what about the triggers for asthma?
No, I want to know common signs and symptoms.
Like feared by other like allergic reaction?
Okay, it can mimic an allergic reaction. Okay, I see where you got chest tightness. Okay. I mean, really causes is there's triggers. If you're allergic to stuff, remember what happens. You have the blood vessels, the capillaries become permeable. And they start leaking plasma, which closes off the bronchioles. SS is signs and symptoms.
Coughing could be one of them too, correct?
Yeah, but can you have coughing with pneumonia, bronchitis, CHF, emphysema? Why absent lung sounds? I mean, if the bronchioles become so constricted that they completely shut down, then yeah, you'll have absent lung sounds, but you hope you never get there. Or really severe cases. But can
Lou,
that be caused? Huh?
what about anxiety?
Okay, but isn't that common? If you can't catch your breath, aren't you going to be anxious?
Yes, sir.
Yeah.
Yeah. You guys are jumping around. So there are some that are unique to asthma. Now, if you look at the book, it has a big list. But do we want to Actually, let me rephrase that. Are there a lot of signs and symptoms in asthma that you find with all of them? Yeah. So instead of like trying to pick each one apart, because you guys keep giving me everything that's common, give me some other common signs and symptoms when someone's suffering from shortness of breath. So think about it. They can't catch their breath, regardless of the condition. What are you going to find?
Low O2.
What do we call that?
Apnea or
No, apnea is the absence of breathing.
It's hypoxemia or no?
It's what?
Hypoxemia or something like that?
Yeah, hypoxemia.
It'll be pale and sweaty, no? Clammy.
What is?
The patient.
More specific than that.
The skin?
The skins, thank you.
Yeah.
What else?
Tachycardia.
Tachycardia. Huh?
Tachypnea.
What was that?
Tachypnea. I can't pronounce it.
Tachypnea?
Yeah.
but issues with their blood pressure? Changes in blood pressure?
How so?
Would it be because of inadequate perfusion?
What was that?
Would it be because of inadequate perfusion? Since they're not breathing properly, they're going to start having issues with their blood pressure and signs
so,
of
though?
their.
How so?
Well, their
Well, because-
blood flow. I'm sorry, go ahead, Ray.
No, I'm sorry. Wouldn't that be because they're going through a different type of metabolism because they're not getting in O2?
Okay.
So then, I'm trying to get the chain going. So they're not going through. They're going through anaerobic metabolism because they're not getting in O2, which is going to cause. Sorry, I'm like I know this. I'm like drawing a blank right now. But that's what's causing the drop in BP.
Okay. So you're saying that the person is going into shock,
Yes.
hyperperfusion. Okay.
Yes.
What happens to the blood pressure in hyperperfusion?
Decreases.
It does?
Could I hear the question again? You kind of cut out.
Go ahead. And no, it doesn't increase.
You asking what the BP is going to do?
I couldn't hear you.
I'm sorry, you cut out on the question, Lou.
No, somebody said the blood pressure increases. Does it increase?
No.
No, it
No, it
doesn't.
decreases.
It may, but it usually stays normal. Now, you can have hypertension with CHF, though. What else?
They'll be fatigued.
Okay, they can become fatigued from
Not being able to breathe.
not being able to breathe for a long time. I think you guys are gasping at straws. Gasping at straws. Not gasping, grasping.
Pale,
Cyanotic at the end.
We already did pale co-clammy skin.
Okay.
Oh, speechless.
What?
The speechless or like having trouble talking.
Oh, like going loopy.
I think it means altered mental status.
Yeah.
Although you're not always going to see that, only if they get bad, but okay. Again, you guys are grasping. It's in your book. So, see, we got tachycardia, we got tachypnea. If you're needing to get more air, what's going to happen to your nose?
Flaring.
Okay, nasal flaring. Talked about accessory muscle use. How about tripoding?
Yeah.
Leaning forward, arms between your legs, try to get more air in, expand your chest. Right? Diminished breath sounds. Doesn't specify what the sounds are, just diminished breath sounds.
how about the inability to talk in a full sentence?
Not necessarily, but okay. What else?
Excess coughing.
Diminished
No,
SpO2
no,
levels.
I'm debating cough or excessive cough.
We're doing common signs and symptoms of all of these, correct?
Yeah.
Okay.
Okay, let's look at emphysema. What is emphysema? So I'm a 58-year-old guy.
It's
I'm
that.
slender. Huh?
Sorry. Go ahead with
No. Go for
it. No, you cut out, Lou. I'm sorry.
it. I said you go.
Oh, I was gonna say emphysema is it's like scarring of the lungs, right, or damage to the lungs, usually by like smoking or
Nope.
no.
I mean, it
It's
can be
like
caused by smoking,
COPD, no?
but it's
That's more like COPD.
well, emphysema falls under COPD.
Is it liquid in the lungs?
No, not liquid. That's more like CHF. No, they're not ruptured alveoli. All right, you said destruction of alveoli. What do you mean?
Damaged alveolar walls.
Okay. So then what happens?
It makes a gas exchange difficult.
Okay, how so?
Repeat what you said, Gabe.
What was that?
Could Gabe repeat what he said? I'm trying to see if I can help him a little.
Say it again, Gabe.
It's damaged alveolar walls that are caused by, I guess, crazy lifestyles like smoking or jobs
something-
where you work with
Chemicals.
and that damage doesn't allow gas exchange properly between, hold on.
It's a form of COPD. Chronic obstructive pulmonary disease. There's like a decreased surface area in the alveoli. So there's not proper perfusion going on, I'm assuming, right? Because there's like less surface area.
Mm-hmm. It actually, carbon dioxide gets trapped within the alveoli.
Okay.
It uses surface area, so carbon dioxide gets trapped. It interferes with the exchange of gases with perfusion. No, not perfusion. Respiration. Gas exchange. So, because of that buildup of carbon dioxide now, what happens to your breathing pattern or to your breathing?
It becomes like it's. I read it somewhere saying.
And I mentioned this.
You never fully take like a full.
You can't take a full breath?
Yeah, something like you never fully like are able to use your lungs like proper capacity. I saw it somewhere.
Says it becomes difficult and
Yeah.
we become active rather than passive.
Okay, why?
Because the carbon is trapped inside of the alveoli.
The carbon dioxide.
Yeah.
Carbon and carbon dioxide are two separate things. Okay. So.
No, go ahead. I was gonna say that.
I want to see what you guys know. Or actually, I should say, I want to see what you guys are reading.
So decrease blood pressure. So progressive disease, I remember seeing that too. I think that's kind of what I was like going on, like that the carbon is like consistently building up in the person.
Okay. You guys haven't answered my question yet, though. Don't ask me what it was. It was too long ago. I know we've covered this, so think through the process. Our alveoli are damaged.
Okay.
And carbon dioxide gets retained within the alveoli. So it loses surface area. So what's the body trying to do and going to do?
The body's trying to get air, so it's going to breathe harder. It's going to try harder to breathe.
Close, but not quite.
Is it the body is trying to get rid of the carbon dioxide so it starts breathing faster?
Not necessarily.
Yeah.
I mean, that's part of it, but there's something else that's going on. Gasping for air with emphysema, maybe, but somebody earlier mentioned about active and passive process, becomes an active instead of a passive process. But I want to know what else we have to worry about with that. Why are the muscles having to work to exhale? Think about the process. Normally, muscles contract, active, to create that negative pressure. Air goes in.
Mm-hmm.
Passive process, the muscles relax and the air goes out without working. With emphysema, usually smoking or what kind of atmosphere am I thinking about?
Environmental.
Okay, environmental atmospheres.
On the air, something like that.
Okay. Are gonna break down, weaken the alveolar walls. And so they expand, they lose surface area, so carbon dioxide gets trapped. So some said we're gonna breathe faster to get rid of it, but was it Rakisha that talked about the active process now instead of passive? Or was that you, Jesse?
That was me.
It was you. Okay. So I want to know why it's active.
Is it because they're becoming hypoxemic?
Hypoxic?
Yeah.
They're part of COPD. Remember I said emphysema is a type of COPD.
That's good.
So they're going to have a
Okay, good.
normal low CO2 level. I'm sorry, normal low O2 level. So that's not really what's happening. The body, now remember we talked about in the past
Love you.
how what drives us to breathe is our carbonic drive. But now it's switched. It's no longer the carbonic drive. Now it's the hypoxic drive. So what I want to know is why they are actively exhaling.
Because of increased airway resistance.
I'm
Is
not
it because
quite.
of lung tissue?
Huh?
Because of lung tissue changes?
Well, that's how we got here in the first place.
For carbia.
Huh?
No, I'm sorry, Lou. I thought it was me talking to myself.
Okay. We're gonna be here till tomorrow if we keep this up. Think about it. What did we build up now? and I know I talked about this like last week or the week before. What did we build up?
They built up
Carbon dioxide.
Yeah, carbon.
No, you guys got to stop saying carbon. It's carbon dioxide.
Carbon
Carbon is what you put in your grill to create the fire. Okay? It's carbon dioxide. We're building up that carbon dioxide. And I think it was Candace that said about getting rid of it.
Hypercarbonic, right? Or hyper.
No, not stop. Stop. Like I said, we're going to be here till tomorrow. It's real simple. Again, you have your carbon dioxide that builds up.
Okay.
And remember, we talked about it the other day, how you're going to have a prolonged expiratory phase to try to get rid of as much carbon dioxide. Remember when we talked about asthma, was it last week, week before?
Yes.
Yeah.
Because of the constriction of the bronchioles, carbon dioxide is building up. So that's why it's expiratory wheezes, and they have a prolonged expiratory phase because they're trying to get rid of as much carbon dioxide as they can. And so why is it an active process? Because the muscles in the body are trying to push out that extra CO2 that's found in there. Even though we switched to a carbonic or to a hypoxic drive, we're still trying to get rid of some of that carbon dioxide. And so prolonged expiratory drive or prolonged expiratory phase. If you remember at the beginning when I was doing asthma, it's longer to try to get rid of that extra carbon dioxide. Okay, so that is why. Try to remember. Emphysema, yes. Chronic bronchitis, yeah. Pneumonia, no. We'll put it right here. Okay. So again, emphysema is where we lose elasticity of the alveoli and we get air trapped within those alveoli, or we get carbon dioxide trapped within that alveoli. So it kind of just lingers. And so over a period of time, the body switches from a carbonic drive to a hypoxic drive. So that carbon dioxide level is building up. Okay. All right. So what are unique signs and symptoms when you go on a respiratory call? How are you going to know this is emphysema?
Pursed lips.
Yeah, PEEP.
But pursed lips, you can find it with others too. Okay. I'll give it to him.
What about barrel chested?
What do you mean barrel chest?
A barrel chest appearance from air trapping in the alveoli, causing the anterior posterior diameter of the chest to increase.
Simple. Not everybody understands all that stuff.
Just a broad, big chest. Not necessarily muscular, just a big barrel chest. I don't know how else to explain it.
Usually they're thin, and the chest and abdomen, it looks like a barrel. They're
like disproportionate, right?
What do you mean disproportionate?
It's what I've never seen it myself. It's what I based upon the way the book describes it is it looks like a like a deformity almost, like
what?
Like a deformity, like they're not the size of their chest is much bigger than how their body is proportioned.
Think about a barrel. Think about a barrel.
Okay.
That's what it looks like.
It's round.
Mm-hmm.
Lou.
Yeah.
So would it be like, you know, when you see a kid that's learning how to swim and he takes that big breath, how his body just gets fat? That'd be the same thing, but with adults? Barrel chested?
Do that, or say that again?
You know how like someone that's barely learning how to swim, they always take a big breath in before they jump in the water, but you can see that they're taking a huge breath. It doesn't look normal. Would that be considered barrel chested because everything's just expanding?
I honestly don't know what somebody looks like swimming because I don't know how to swim.
Well, see, we'll take you and then we can see.
That's gross.
You see the chest?
Yeah. Would that be like a very extreme case right there, though?
No. Well, this guy's dead, so he's lost air and things.
Okay.
And if you look at the side view here, it shows you the same thing. Same thing. I mean, here's a drawing to kind of show you normal, but you see how it's bigger and round?
Yeah.
Or that one?
Yeah.
There's another one. So, was that what you're referring to, Gabe? Ooh. Gabe? Okay. What else?
It's the first thing you put down with the long respiratory phase. That's the only thing we'll find in emphysema.
Well, that's separate from what we already did.
What about diaphoresis? Or
Common
diaphoretic?
one. That's a common one. But they're on O2 at home.
As far as like I was reading that their SpO2 readings are 94% or higher.
That what?
Their at the bottom of the page, it says that their SpO2 readings are 94% or greater and less than respiratory failure. So like that's saying that for the most part, they're when you pulse ox them, they more than likely are going to read closer to normal, right?
Well, if you go by 95 and up as normal, yeah. But they're usually going to be about 93, 94, 95, 96. They usually won't get higher.
They're easily fatigued with minimal exertion.
You could do that with the others. So productive cough. The pink puffers and the blue bloaters. So on the topic of COPD, now we got chronic bronchitis.
Wheezes and crackles at the bases of the lungs.
Is that unique to chronic bronchitis?
No, I guess not.
It says minimal difficulty in breathing.
Wheezes and crackles at the base of the lung. Okay, what's happening with chronic bronchitis?
Inflammation, right? Inflammation in the alveoli.
The condition is in the name.
In the bronchi and bronchioles.
Yeah.
And bronchioles.
So this is where an individual has bronchitis for 3 straight months. Doesn't go away. Again, it's a type of COPD, so it's commonly found in smokers. So you heard of the term smoker's cough?
Yes.
Right.
That's what we're talking about. And productive because of the phlegm that's in there, of the gunk. All right. Anything else? So you guys are talking about, or at least you're opening up the book. You talked about wheezes and crackles, although that's not specific to chronic bronchitis. Let's talk about pneumonia. What's happening with pneumonia? Huh? Oh,
It's caused by a bacterium or a virus that affects the respiratory tract.
is it a virus?
It can be.
Okay.
Or infection.
Okay.
I know a lot of people get it from cancer and HIV.
Okay. Primarily, it's caused by a bacteria, pneumococci or something shit like that. Some viruses cause due primary bacteria, though. It's an infection in the lungs. It could also be caused by foreign substances. If you aspirate something, get into the lungs, the body's trying to fight it, and it's causing an infection in there. What happens is that pneumonia, and we're usually talking about the bacteria, although virus too, but primarily bacteria, it's a very opportunistic infection. It waits for your immune system to be depressed. So if you've just been sick, guess what? It doesn't have a lot of fighting ability left, so it overtakes it. So Patrick, as you were mentioning about HIV, remember HIV/AIDS, their immune system is compromised, so they're not able to fight it. So yeah, they're more prone to pneumonia and other infections. And really, once they have AIDS, that can kill them because they can't fight off those infections. A simple cold can kill them.
I know a lot of people are getting COVID and then they get pneumonia and end up passing recently with everything going on.
Run that by me again?
So there's been a lot of people that will either get pneumonia, start getting better, but then catch COVID, or vice versa. They're getting COVID, getting hospitalized, and then they're then getting diagnosed with pneumonia after.
Yeah, because their body's fighting the COVID. And so again, just like I said, their immune system is weakened.
Yes, sir.
So it comes in. Okay. So what pneumonia causes is what we call an infiltrate, basically clouding in the lung. So trying to show you guys. So over here on the left, you see a lot of dark. You can still make out the alveoli, the bronchioles, but you see this cloudiness over here on the right?
Yes.
That's an infiltrate. You see some more over here. You see all that white speckles? Those are called infiltrate. Here's a good one. Then again, they have tuberculosis too. Because air, oh, there's something wrong with this lung. Yeah. The lungs should look like this. This should have the point there and a point over here, and this doesn't have a point. But anyway, so you see the black, that's air. So X-ray, when it goes through air, it comes out darker. The white borders, those are the bones. You could even tell male and females. This is a female. You see the outline right here, the white, that's the breast tissue. So this is a female breast. But you see the sharp edges I was talking about?
Mm-hmm.
She has some gas too. This right here, that's gas. Man, I miss my X-ray days. But anyway, so so that's an infiltrate. So that is not able to diffuse oxygen because that gunk is there. Think about, have you ever had a big pimple or a wound that got infected and you squeezed it and a lot of pus came out? Or better yet, have you ever seen videos from Dr. Pimple Popper? Okay. Just think about that. All that, I mean, it's not that that kind of constitution, but it's blocking the oxygen's ability to get into the alveoli. And so is the patient able to get oxygen and be normal with their oxygen levels? And the answer is no, right?
Right.
It's
It's no.
Okay. The answer is no. And so what are you going to see in that patient that has pneumonia?
Really bad coughs, no?
Okay.
Fever.
Why a fever?
Because the infection.
Okay.
Or a virus too can cause a fever on its own.
Yeah, it's an infection. Fever is a normal response of the body to fight off infections. It basically makes it an untenable atmosphere. In other words, how long are you going to stay in a car without air conditioning?
Depends if I'm trying to look good or not.
Not for long.
I don't care if you're trying to look good or not. You're in there, and the owner of the car doesn't want you in there. And it's
Dude, it's called the
105
Mexican
degrees
sauna.
today. Huh?
They call it the Mexican sauna for a reason.
I've never heard that term, so. So I'm trying to, I can't even think anymore. I'm trying to paint a picture for you guys to understand what's happening when there's an infection going on. The body's gonna make inhospitable atmosphere.
Hey Lou, have you ever seen I'm sorry, it's not really off topic, but there's that movie Osmosis Jones that shows it's like a cartoon / thing with Bill Murray.
Yeah.
That shows that exactly what you're trying to explain.
Yeah, the body's raising the temperature, so the bacteria or the whatever's attacking the body doesn't survive. So that's why they sterilize, or how they sterilize things. Really hot temperatures to kill this stuff. All right. What else about pneumonia?
Would they have a diminished chest rise and fall since they're not taking, able to take in full breaths?
But isn't that common with all the illnesses?
No, you're right.
What else?
It says splinting of the thorax by the patient with his arm.
It hurts to breathe. Okay. No, I think it's. Yeah. With pneumonia, it's very common for the person's chest to hurt. The coughing fits. And people have known to collapse the lung with how hard they're coughing. Okay. We'll pause here. It is 8:08. So be back at 8:25.
Sounds good.
All right. I'll see you guys then.